Okay, welcome back, everybody. I hope people are fortified for the journey for the second half of our webinar. This afternoon, we're going to go through a similar exercise that we did this morning. This morning, it focused on what we were calling non-traditional worker groups who might be respirator users. This afternoon, we're turning to public users, but going through a similar approach. And our session moderator for this group is going to be Dr. John Balmes, who is professor of medicine from the University of California, San Francisco. Take it away, John.
Thank you, Melissa. So this session is called Respiratory Risk and User Requirements for the Public. And I want to go back to the discussion that Rich Meltzer started today when he talked about what is the risk that we're trying to protect people from with a respiratory protection program. And the risk to the public, what is the hazard? And when we started planning for this workshop, I think in large part it was wildfire smoke that has caused huge air quality problems in the Western US, especially in California. And so it's really PM 2.5, fine particulate, that wafts for many miles in a plume of wildfire smoke downstream from the fire. So we're not talking about the hazards to wildland firefighters that Joe talked about last session. We're talking about public exposure to lesser levels of wildfire smoke. So in dealing with the public, in terms of the goals for this session, we have to talk about protecting kids as well as adults. So that's a big difference from the last session. And we have to talk about what type of respiratory protection. We're not just talking about N95s here. And we also have to remember, as has been brought out, that there'll be an absence of a respiratory protection program here for the public. Whatever respiratory protection is used will not be fit tested. So will they work? And are they safe? Are they safe? And then the elephant in the room, COVID, actually brings up a whole host of issues in terms of facial coverings and what's appropriate. But actually, there's an interaction out here in the Mountain West between COVID and wildfire smoke. So I'm happy that we have three really good speakers, and I'm going to start with our first one. Who's Claire Hewson, a certified industrial hygienist with the Department of State. And she'll tell you why the Department of State is concerned about respiratory protection of non-workers. Claire, take it away.